Hello everyone. This first topic is LSD research with 3 cases reports. So this first topic is all about consequence of bipolar disorder. By a 8 years old female, she experienced a significant reduction of systems in previous diagnosed by bipolar disorder. So that means it's a hallucinogen. She take cannabis without knowing na it's bad for herself, for her mental health. Means it's a hypomanic symptoms. That means is feeling extremely and that feeling extremely and high level of energy. The second case report is all about pregnancy. According to this report, the woman reported she was lost of consciousness or to communicate at the age of 26 years old. She felt pleasantly of high for the next 12 hours with infrequent vomiting. When the morning arrived, she was able to engage with others and repeat the events of previous at the night. That means the girl was dangerous to his son because she drink a lot of alcoholic drink and she also take a cannabis, and then after 2 weeks ago she knew that she was a pregnant, which is that's a bad of her health because she was a pregnant. The last report is massive LSD overdose associated with reduction of physical pain and morphine, which is the girl was 20 years old. There was a prescribed of morphine of analgesics, which is she take a lot of morphine, and then after a fast of her pain, she not afraid what she was doing for help because she knows that she felt a pleasant high. But the end of the day, she is experience of anxiety and the increase of sensitivity and also depression.
Objectives: review the proposed mechanism of action of LSD, describe the adverse event profile of LSD, summarize the toxicity that can accompany LSD use, explain the importance of improving care coordination among the interprofessional team to enhance care delivery for patients who are currently or have previously misused LSD. In academic settings around the world, there is a resurgence of interest in using psychedelic substances for the treatment of addictions, post-traumatic stress disorder, depression, anxiety, and other diagnoses. This case series describes the medical consequence of accidental overdose in 3 individuals. There appear to be unpredictable positive sequelae that range from improvements in mental illness symptoms to reduction in physical pain and morphine withdrawal symptoms. Also, an LSD overdose while in early pregnancy did not appear to cause harm to the body. Trips on LSD can go from bad to worse in a matter of minutes. Some symptoms of a bad trip can arrive within a few hours after ingesting LSD. Such side effects can range from uncomfortable overwhelming. Bad trip symptoms to be mindful of include spike in core body temperature and excessive sweating, dilated pupils, numbness of the body and extremities, spasms or convulsions, loss of appetite, anxiety, mood swings, flashbacks, paranoia, and harmful ideas, thoughts of suicide.
Good afternoon po. My name is John Robic Anchoris and I will be discussing the methods of our topic, which is LSD overdoses. 3 case reports. In case report 1, it's about the 15-year-old female known as AV who ingested more than 1,000 micrograms of LSD and experienced positive effects on her bipolar disorder. The methods used here is the interview with the 15-year-old female, her father, and the supplier of the LSD, and also the observers of the incident. They also reviewed the document from the 2 hospital admission, the records, and the mental health team case notes. In case report 2, it's about the 26 years old pregnant female who ingested a glass half half a glass of water infused with LSD, where the research says that overdose of LSD on a pregnant woman did not affect the pregnancy and didn't cause harm to the fetus. The methods used here to get information is the interview with the pregnant woman known as NM and her son, and also the godfather of the son and the supplier of the LSD. Yun lang po, thank you po.
Hello, my name is Kurt Aquino. In this third case report, the method used was from the interviews with a 14-year-old woman known as CB and her roommates who witnessed the event. Overdose on 55 milligrams of what she thought was cocaine. But it was actually LSD in powder form, with no other additives. This was equal to 550 times the usual, commonly used, and healthy recreational dosage of 100 micrograms.
Intentional LSD overdose. The first case report described dramatic improvements in mood symptoms, including decreases in mania with psychotic symptoms, changes that have persisted for almost 20 years. On the first case, it is documented that the unintentional LSD overdose was good for the improvement with someone who is diagnosed with mental health disorder, and it is sustained for almost 20 years now. The second instance show how an intentional overdose of LSD during the first trimester of pregnancy had no clear tetragonic or other adverse development effects on the kid, nor did it adversely alter the course of the pregnancy. While on this case, when a pregnant woman unintentionally takes a high dosage of LSD, there's such no bad effects on her pregnancy, and her son has nothing negative effects on his development. According to the third report, 550 times of the usual recreational dose of LSD taken intranasally did not result in death and had beneficial effects on no pain levels and subsequent morphine withdrawal. On this case, in a 46-year-old female, a 150 times of international ingestion in a normal dosage of LSD cannot cause death but can cause positive effects on the following pain levels, and she made to decrease her morphine and to reduce her withdrawal.
The effects of 3 unintentional LSD overdoses on the body are described in these case studies. This information is unusual because there are no papers examining the beneficial effects of extremely high LSD dosage and no clinical trial studies that could be conducted with these levels. The anecdotal nature of the data the lack of available urine or blood samples, and the approximation of LSD dosage are the analysis shortcomings. Even though everyone who participated in this experience found it upsetting, there are seem to be anticipated beneficial side effects that range from improvements in mental disease to decrease in physical pain and opiate withdrawal symptoms. Additionally, an early pregnancy LSD overdose did not seem to harm the fetus. The historical safety is built upon in this report. These case studies describe the impacts of three unintentional LSD overdoses on the body. There are few to unexpected beneficial side effects ranging from improved mental disease symptoms to a reduction in physical suffering and painkiller. Side effects: an LSD overdose during early pregnancy did not appear to abuse the unborn child.
Conclusions: LSD seems unpredictable. It manifests positive results like morphine withdrawal syndrome, reduction of body and physical pain, and some improvements from mental illness symptoms. In 3 case studies, it was presented in different situations with almost same effects. Case number 1, a patient with bipolar disorder. After accidentally took LSD, the patient was observed having a significant improvement in mood symptoms. Case number 2, a pregnant. She accidentally overdosed the prescribed LSD that did not affect her pregnancy, considering it was happened during her first trimester of pregnancy. Case number 3, a 49-year-old woman who prescribed LSD for her disease, but in the end, there's no bad effect after that event. Overall, LSD did not affect the 3 case studies negatively. Thus, it shows positive results in the 3 case studies despite the worry of negative impact of the said drug.